community health educator here at Planned Parenthood Keystone in Pennsylvania. Under normal circumstances, what that means is I go all over to different places and talk to people of all ages about issues related to sexual health, relationships, changing bodies, things of that nature. Unfortunately, due to the circumstances of COVID-19, that's no longer the case. We know that a lot of people are having new normals, and one of our new normals is a lot of people like you going to school online for the first time. Here at Planned Parenthood, we know that just because school is no longer meeting in person doesn't mean that the really important questions you have about sex and sexuality are going away. To make sure that all your really important questions are answered, we created a video series talking about issues we know are important to teens like you. If you have any questions after these videos are over, you can actually sign up to chat with me online about anything related to sexual health. You can make an appointment to chat with me where I can answer your questions at calendly.com/ppkeyhrc. You can also sign up to attend one of our LGBT youth groups called The Spectrum, and to do so, you can contact us on Instagram. We're at The Spectrum Berks. You can also get any other information about Planned Parenthood at plannedparenthood.org. Thanks, and we hope you enjoy these videos. Planned Parenthood is an organization that's over 100 years old and has been spending all that time helping millions of people get the sexual and reproductive health care they need and deserve. We do a lot of things. Some you might be interested in now, and others you might be interested in or need during a different time in your life. One of the things we do a lot is help people find and get the best kind of birth control that works for them and their lifestyle. Today I'm going to talk to you about what birth control is, why and how people use it, and how you as a teen can get access to it. So what is birth control? Birth control is any method, medicine, or device someone uses to prevent pregnancy. Birth control is a great option for anyone who's sexually active and doesn't want to get pregnant. But not everyone who takes birth control can get pregnant from their sexual activities. And many people who are not sexually active still use birth control. Why would someone who's not at risk of getting pregnant use birth control? Depending on what kind of birth control you use, birth control can have positive side effects, such as regulating one's period by making it regular, lighter, and less painful. It can also help clear up hormonal acne and can manage symptoms of certain conditions such as endometriosis or PCOS, which stands for polycystic ovarian syndrome. There are a lot of kinds of birth control, and finding the one that works best for you, your lifestyle, and your body is an important process that can sometimes be overwhelming. Over the next couple minutes, I'm going to go over some different kinds of birth control, how to use them, and where to find them. The first one we're going to talk about is condoms. Condoms are thin, stretchy pouches that one wears over their penis during sex, and it collects any fluid that comes out of the penis during sex, such as pre-ejaculate, also known as pre-cum, or semen. Condoms stop sperm released from the penis during sex from entering the vagina, so that sperm can't meet up with an egg and cause pregnancy. Because condoms create a physical barrier between penises and whatever body parts they come into contact with, they are also the only form of birth control that can prevent the spread of STIs, also known as sexually transmitted infections. If you decide condoms aren't the best form of birth control for you, that's okay, but we still recommend using them for that reason, whenever you have oral, anal, or vaginal sex. Condoms are also the only kind of birth control that people with penises can use to help prevent their partner from getting pregnant. Condoms are easily available at most convenience stores, drugstores, health clinics, and Planned Parenthood centers. They are inexpensive, and at Planned Parenthood, they're free. The next kind of birth control we're going to talk about are different kinds of hormonal birth controls, which use synthetic hormones to prevent pregnancy. The first kind we're going to talk about are birth control pills, sometimes just called the pill. They're a once-daily medication that someone with a vagina and uterus takes daily to prevent pregnancy. Birth control pills come in a monthly pack, and you take one pill every day at the same time. The pill uses hormones to prevent ovulation, which is the process of an egg being released from the ovary into the uterus. They also thicken the cervical mucus, which creates a barrier so sperm that's inside the vagina can't swim into the uterus. The pill is safe, affordable, and effective if you take your pill every day at the same time. When used perfectly, the pill is 99% effective at preventing pregnancy. But people aren't perfect, and sometimes it's easy to forget or miss a pill. So in reality, it's about 91% effective. When you have a busy life, sometimes it's hard to remember to take your pill every day. So here are a couple tips people use to help them remember to take their pill. They set a daily alarm. They put their pill next to their bed and take it first thing in the morning when they wake up. Some people pair taking their pill with an activity they already do at the same time every day, like brushing their teeth before they go to sleep or getting on the school bus. Besides preventing pregnancy, the pill has other health benefits for people who take it. It can help get rid of hormonal acne, can lessen period cramps, and make your periods lighter and more regular. Remember, the pill is great at preventing pregnancy, but it doesn't do anything to prevent the spread of STIs, so always use condoms in addition to the pill. Don't think the pill is the best option for you? That's okay, because there are many other birth control methods available to you at your local Planned Parenthood or other healthcare provider. One of them is the shot, also sometimes known as the Depo-Provera or just the Depo. Instead of taking one pill every day, you can get those same hormones in the form of a shot in either your arm or your upper buttocks once every 3 months. That means you only have to think about birth control 4 times a year. When you remember to get your shot on time every time, the shot is 99% effective. But sometimes people miss a shot, so overall it's 94% effective. Just like the pill, the shot does nothing to prevent STIs, so condoms are great for every time you have sex. The next form of birth control we'll talk about is the vaginal ring. Like the name sounds, this birth control is a small flexible ring that someone inserts into their vagina to prevent pregnancy. Inside of the ring are the same hormones that are used in the birth control pills and shot, and the hormones are released from the ring into the vagina over a period of 3 weeks. After 3 weeks, you would take the ring out and have 1 week with no ring in. This is the same time you'd get a period. At the end of that week, start the whole process over again. The ring is small and flexible, so when you insert it, you can fold it up small, and once it's fully inserted, it'll release to its original size. Like a tampon, if you insert the ring correctly, you shouldn't be able to feel it. Because of its size and shape, the ring is secure and doesn't fall out in your daily life or during sex. If for any reason it does fall out or move around, you're still protected as long as you reinsert the ring within 2 hours of it falling out. Just like every other kind of hormonal birth control we've talked about today, the ring's best friend is condoms. We always recommend using condoms in combination with whatever hormonal birth control you choose. If none of these options are still appealing to you, that's okay. Next, we'll be discussing the birth control patch, which is a small sticky patch similar to a Band-Aid or a nicotine patch, and it releases those same hormones through your skin to prevent pregnancy. How do you use it? You put a patch on your upper arm, shoulder blade, hip, or buttocks, and then wear it for a week. After 1 week is up, remove that patch and replace it with a new one. Repeat that process 1 more time, so you've worn 3 patches in 3 different weeks, and then the last week of the month, don't wear a patch. This is the same time you would get your period, just like with the Nuva ring. The patch is waterproof and sweat-proof, so you can still shower, swim, and sweat without worrying about it coming off. After you do get that area quite wet though, we recommend quickly checking on your patch and making sure it's still fully sticking, just to be safe. As we wrap up this video, we'll be discussing 3 more long-term birth control methods. The first is the implant, also sometimes known as the rod or the Nexplanon. The birth control implant is a tiny thin rod about the size of a matchstick that a doctor or nurse can place inside the inner portion of your upper arm. Once the implant is placed, it slowly releases hormones into your body to prevent you from getting pregnant. The implant lasts for 5 years, and during those 5 years, you don't have to do anything to maintain it. You simply get it and forget it. The birth control implant is 99% effective at preventing pregnancy. Like any other medication, the implant has potential side effects such as changes in your period, headaches, nausea, and weight gain. You can also have a tiny bit of bruising on the part of your arm where you got the implant just for a couple days afterwards. The implant is a great birth control option for many people, but like other kinds of hormonal birth control, it does nothing to prevent the spread of STIs, so we always recommend still using condoms for any time you have oral, anal, or vaginal sex. The final 2 kinds of birth control we'll be talking about are 2 different kinds of IUDs. IUD stands for intrauterine device, and it's a small T-shaped device placed inside someone's uterus by a doctor or nurse. There are 2 different kinds of IUDs. The hormonal IUD, which uses the same hormones as the implant to prevent pregnancy, and the non-hormonal IUD, which uses copper to prevent pregnancy. The hormonal IUD lasts for between 5 and 7 years, depending on which brand your doctor prescribes you. On the end of the IUD are 2 short strings that if you reach inside your vagina, you should be able to feel. Once a month, check to make sure you can still feel the strings to ensure the IUD is in place and still doing its job. Besides that, there's nothing else you have to do to maintain your hormonal IUD. For the first couple of days after getting an IUD, it's completely normal to have some cramping and backaches, but that will go away once your body gets used to the device. Some other potential side effects are changes in your period, such as it getting lighter or even going away, and spotting in between periods. Non-hormonal IUDs are the same shape as hormonal IUDs, but instead of having hormones inside, the non-hormonal IUD has small coils of copper on it to prevent pregnancy. Once the copper IUD is inserted, you just need to check your strings once a month, just like with the hormonal IUD. Besides that, there's no maintenance. The non-hormonal IUD lasts for 12 years and is a great option for anyone who knows they don't want to get pregnant for a long time. The copper IUD is also a great option for anyone who's been told by a healthcare professional that they are not a candidate for hormonal birth control. Like the hormonal IUD, cramping and backaches are normal for the first couple days after insertion. The copper IUD can also cause changes to your period, usually making it heavier and with more menstrual cramps. Both kinds of IUDs are 99% effective at preventing pregnancy. Neither of them, however, do anything to prevent the spread of STIs, so we still recommend using condoms with them. I hope now that you've learned about all different kinds of birth control, you feel more confident in being able to choose what kind of birth control is best for you when or if that time comes. Birth control isn't for everyone, but here at Planned Parenthood Keystone, we believe all people, including young people, have the right to receive birth control if that's what they want. To help make this belief a reality, all family planning services, including birth control, at Planned Parenthood Keystone are free for minors, and we don't need your parents' supervision or consent for you to receive medical services. To learn more about how to get birth control or make an appointment, go to www.plannedparenthood.org.